everyone, and welcome to the first panel discussion in a series Conversations in Health Sciences hosted by myself, Dr. Diane van Staden, Academic Leader of Teaching and Learning within the School of Health Sciences at the University of KwaZulu-Natal. Today we will be discussing the important topic of transformation within South Africa's higher education sector. And while not a new topic, it certainly is still critically important to the ongoing development of the higher education sector in South Africa. Now, if we look at the raw definition of transformation, it means a complete change in form, structure, and appearance. And so today we will be discussing what that means for higher education and for health sciences in general. Joining me today is a panel of academics from the School of Health Sciences, and I'll introduce them in a short while. But why do we want to discuss this topic of transformation in higher education and health professions education today? Well, as we all know, South Africa's past is one of inequality. And in order to address the historical inequalities of the past, the higher education system in democratic South Africa has been mandated with a transformation imperative. And so today we hope to break down what that means for each of us as individual academics within our respective programs and within our institutions. So I will introduce to you now our panel of academics. Starting from my left, we have Dr. Alvin Munsami, who is an optometrist and a senior lecturer within the discipline of optometry at the University of KwaZulu-Natal. We have Dr. Stacey Maddox to my immediate left, who's a physiotherapist and lecturer within the discipline of physiotherapy. And to my right, we have Ms. Sandile Shezi, who's a doctoral candidate and lecturer within the discipline of audiology. And to my far right, we have Professor Saul Cobbing, who's the academic leader for physiotherapy as well as a physiotherapist within the discipline of physiotherapy. So thank you for joining me, everyone. And I hope today we'll have a fruitful discussion around this very important topic. Now, just looking at our grouping, all of us have been in academia for 10 or less years. So we would consider ourselves relatively new or young academics. And we've entered this space under this umbrella of a transformative agenda within higher education. So please can we open up the floor today to share your thoughts on what transformation means to you as an individual and what it means for us within health professions education within the higher education sector more broadly. Professor Cobbing, I'll invite you to open up the discussion.
Thank you, Dr. van Staden. I think this is a very important discussion. We kind of talk around these issues but don't really focus on it. And often we just look at how things look. And certainly when I came into UKZN about 10 years ago, you know, it was different from where I studied, both in South Africa and abroad, where it would have been, you know, far more white people, not really as representative of the population at large. And as I say, visually, when I entered UKZN, I could see it was fairly diverse in terms of both the student and staff population. And in my time here, I've realized that transformation must mean more than just that, you know. And I think that's something we're going to touch on a bit more later.
Absolutely. So if I could just ask you this, on a personal level, how does it feel being a white male in this context of transformation, where in South Africa that largely means that we want to change the perceptions away from white male-dominated sectors to more black and woman representation within our structures? How does that feel for you personally, and what do you feel your role is in the transformation agenda in South Africa?
Yeah, it's a good question. I mean, I think I generally try to look on the more optimistic side of things. You know, some people say white males are kind of a dying breed in academia, but if you look at the numbers, that's not true, and particularly in higher levels, you still do see a lot of white people and males. In my department at the time, I was the only white male, you know, so I kind of joked at the time that I was appointed on demographic. I was a demographic that was lacking, strangely enough. But I must say, we'd be lying if we said, you know, now 27 years post-democracy, that race doesn't matter. The advantage of the skin color and being male, and I see this quite a bit and discuss it with my colleagues, is just the fact that I am a white male. I often get taken more seriously, you know, by students of all race groups and fellow staff members. So there's still, from my point of view, that sort of perspective that somehow my gender and my race confers some kind of extra ability, and that's both a kind of ingrained thought processes that have come from our history as South Africans. So, but to answer, like, what can I do? I feel in a sense I need to use that kind of that privilege and maybe level of respect I get to help change the minds of other people who not particularly committed or resistant to transformation.
Thank you very much for sharing your heart. And as you can see today, the panel is fairly represented. We try to balance the demographics to get the different perspectives. So maybe if I can call on others to comment on what you have said, that by and large within society, perhaps, is there still a perception that white is superior, and how do we change that, especially as academics of color who are coming in to drive transformation within higher education? How do we change the societal mindset that's historically inbuilt in South African people to perceive one against the other as being more superior purely on the basis of color? And I must say that, and put a disclaimer, that I'm not saying transformation is about color. It's one of the things we'll discuss a little later in the conversation. But do you think that still exists?
Yes. I can give an experience that I had personally with a student in her 4th year about 3 years ago. I was teaching, and while I taught, the student had her iPad out and she was Googling while I spoke. So I was talking about a particular topic, and during my speaking, she raised her hand and she said, "You've been going on about this topic for a long time, but you haven't mentioned anything about pulmonary edema." I was talking about acute respiratory distress syndrome. And I said to her, "Could you give me a moment?" And I clicked 3 slides on, and there was the slide about pulmonary edema. Nevertheless, this was just one incident I'd had with the student where she sort of questioned my authority on the subject matter. The year later was her ComServe here, and she wrote to me over WhatsApp, which I shared with Saul and some of the other colleagues, and she said to me, I was given an award for being the best in ICU among my peers in this ComServe year, and my peers have come from other universities, and I just want to say that I owe it to you. My response to her wasn't as kind, though. I told her to give herself a pat on the back, and because the same way we don't take responsibility fully for students who don't do well, we can't take all the responsibility for those who do. So I said, give yourself a pat on the back for applying what you were taught. And then I said, and to think you would look at me like I was some kind of colored fool. I said it. I said it. And her response to me was the emoji with the monkey at the hand over her face, and she acknowledged it. She said, I did, ma'am.
Wow.
So I think definitely the perception, as Saul always alludes to, is the fact that he can walk into a classroom, and by virtue of the fact that he is a white male, the perception is that he is knowledgeable and that he has the right to be standing in front of the class. Whereas for our black counterparts, and I think particularly females, we've got to earn that right in front of the students. So it is definitely a challenge. Often when we want to convey important messages to the students, we tend to call upon Prof. Cobbing or Mr. van Beverdenker, the white males in the department, because of the weightiness with which their message is transferred.
Wow.
Yeah.
Yeah, that's heavy. That's some deep stuff. And I have to agree that sentiment exists by my personal experience. Dr. Munsami, you want to share something? You look like something is on your heart.
So we're in a little bit of a different situation compared to Professor Cobbing department. So we don't have any white males in our department, and we don't have much males in our department. We have a heavy female representative, and I have to say that I respect them a lot because they've led us. And fortunately for me, I don't see the gender color in my department. If anything, I think that I'm underrepresented and in terms of gender, and I worry a lot about our male students. As Dr. Verstappen and I continuously trying to channel some role modeling, but to pick up from my previous two colleagues about what they're saying from a bigger picture, my profession historically comes from a very Eurocentric, Western-heavy background, and the footprint of the color in our profession has only increased within the last 20 years or so, where the structural figureheads in our profession have always been historically white. So basically, in our profession, we've been trying to improve the footprint, but in terms of teaching and trying to represent the profession in a manner in which our white colleagues see us as equals is something that's an unspoken truth in our profession. And I always, Dr. Van Staden and myself are both optometrists, so obviously we have a very close working relationship. And we constantly try to represent she and myself, because we don't have it easy in terms of voice in the profession to represent who we are, what we do. And we have this private conversations of saying, why is it I haven't seen a black man or an Indian man in space? I said, because when I was a kid, I assumed only white people go to space. Right, so that's a very simple analogy of what I'm trying to do in my profession, and I keep on telling her and our staff is that we need to get more black males in the profession, because we've gone so far to the other side that I'm finding the directionless black males in my student population, but very focused black females who can relate to the profession. And so I continuously try to recruit more black males to come in from their practices and to just role model for my black male students, because I just feel that they don't have a frame of reference of who. They can look at me as much as they want to look at me, but they may not necessarily relate to me.
That's right.
And as I'm getting older, there's a gender gap, there's an age gap between me and my students. And as much as I can be as cool for school, right, it's just way more easier when a near peer speaks to my student as opposed to me speaking as if I wrote a textbook. So that's just my experience.
Thank you so much for sharing that. And so there's two things I'd like to pick on and perhaps then ask Ms. Shezi to share. As a black female, it's probably the most underrepresented in the sector. I'm hearing the weight of responsibility to show that you are worthy of standing in front of a classroom, as well as to be a role model for this new cohort of students in your profession. And your profession in particular is one that's very underrepresented in terms of colour. So you want to talk about that weight of responsibility?
The weight of responsibility is quite enormous, because for me, as Stacey was speaking, it brought a lot of experiences that I've been through as an academic in this university, in terms of my engagement with students and how they perceive me. When I started off at the university, I was quite young. I was a black female. I didn't have my master's degree. I was a tutor by then. So already going into the classroom, there was already this perception that I am not good enough to be in that place. I'm not good enough to be standing in front of a group of students and engaging them on, you know, the modules that I was actually teaching them on. And it has taken me a very long time to get to a point where I'm at right now. Every time I walked into the lectures, I second-guessed myself. I questioned myself on whether, am I competent? Am I good enough? Am I worthy to be in this space? And I don't know, maybe in the way that I projected myself, if it came through and the students could pick it up. But that's how I felt. I was made to feel like this by the students that I worked, I was lecturing, as well as some of my colleagues that I was actually working with. And it's been quite a journey for me to get to the place where I'm at, where I'm feeling that I deserve to be here. I have earned to be here, and I shouldn't at any point feel that I'm not worthy to actually be here. So it's a great responsibility. And going back to the students, it's not only maybe white students or Indian students, even our fellow black students will see you in that light to say, you're not good enough, like what are you doing here? You'll see this in the questions that they ask. You will see this in the emails that they send you. Nowadays, we're even using WhatsApp. And the way in which they engage with you, in the way that they send messages to you versus other lecturers, you can see that there is a difference in the way that they actually perceive you. Is it age? Not so much now, because I'm from the time that I started at the university and where I am at now, I've grown. So there's a huge responsibility where I'm constantly pushing myself to sort of like prove myself that I'm actually good enough to be actually in this place as well. And it's a huge responsibility. I think what makes it even more difficult is when some of your fellow colleagues also add on to what the students are also doing. So it's quite a huge responsibility, I must say.
With regards to responsibility, can I just make a comment on what you're saying and what you said, Alvin, about role modeling? In fact, I came in at the same time as you, senior tutor, no masters. We were recruited to come and teach specific subjects where there was a gap. And to be honest, I did not come in here with any intention of getting a PhD, for example. I came in here to teach. So this agenda for research and publication was not part of my motivation for being part of the institution. I really struggled and grappled with that for a long time, until one day I got, after many years, I got the memo, standing in the shower, and I realized, hey, you've been placed in an institution who's offering you an opportunity on a silver platter. You have a responsibility to take that opportunity and become what you ought to be. And so at that point, the responsibility then shifts from all the other things that we blame, like apartheid and you get to focus on what are you doing with this transformation agenda that has been mobilized. Are you stepping into it and taking what you can with it? And for many years, I didn't do that. And so I got the PhD done, ticked the box, served the master of the university, loved the journey, so grateful that I did it. But they never really had a vision, so to speak, to become a professor, let's say. Until again, it dawned on me very recently, I owe it to my people who are so poorly represented in this very institution. As it stands, we have no coloreds in physiotherapy. When I was a student, there were 2 of us. Every now and again, we have one. But as it stands, among the student population, there's not a single colored in physiotherapy. And this week, as in like very recently, like this week, it dawned on me, I've got to push for professorship. Not because of anything else, because I owe it to these kids to show them this mountain has been assigned to me, to show them that it can be moved. And to create pathways and opportunities for our people like us to come up after us. And I feel so strongly that if nothing else, we have that responsibility to fulfill that role.
Can I just add on to what Stacey's saying about that sense of responsibility? It's a conversation that I actually had with a friend of mine, Ziggy, at the beginning of this year, to say that I'm much better in terms of where I'm at, you know, emotionally. And it just clicked on me that, you know what, God put me here for a reason. And if it's not for me, it's for the students that are behind me. And it's for the upcoming academics who are also going to be joining the institution. And I was just saying to him that with all my experiences and all that I've been through, I would never allow any of them to go through what I've actually been through. And that is my responsibility. In terms of how I progress and the length of time it has taken me to actually progress, none of the students that come behind me, I wouldn't want any of them to go through long periods in terms of, you know, my experience and how my journey has been long. And my responsibility is to make sure that I protect them if I can. I empower them, you know, and I advocate for them as best as I can. And that comes back to what Stacey was saying, that it starts in the classroom. It starts in the classroom where you start engaging students even to think about postgrad studies. I didn't think of postgrad studies up until I left the university. It starts in the classroom where you engaging with, you know, with all the students, but particularly intentionally also speaking to the Black community, because postgraduate studies, it's not something that, you know, for us Black people, you get the degree, everybody is happy at home and whatnot, and that's where it ends. And for me, the journey is we're moving from one level to the next, from one victory to the next. We're just moving from glory to glory. And that's what I've told myself that I'm intentionally going to be doing as part of my responsibility. By the time I leave this university, whether I'm a professor or not, but I would love to see students who will come back and say, I actually got my PhD because of Uzandi, this is what she had said to me, or this is what she had contributed, you know, in my life. And that for me would be enough. So that responsibility is so important, even for our students, but even for the fellow academics that are also going to be joining the university.
Exactly.
Absolutely. I think these points are so pertinent, you know. I'm going to go back to what I said quite early in the conversation, that transformation is not about numbers, and it's certainly not just about changing the face or the color representation. I'm hearing here that this new generation of academics are inadvertently the agents of transformation. We may have been appointed under a transformation agenda, but we take on a personal cost and responsibility to driving that agenda, to changing the structure, the form, like we said, as the definition of transformation is. It's up to us. Policies don't do that. It's the people on the ground who have to drive it and enforce it. So I think we have to, within our spaces, continue to say that let's move beyond the surface transformation. How do we get to structural transformation? Transformation of the mind, like we said. How do we change the perceptions of our students? Attitudinal transformation. I'm sure we can all relate to students, mixed students being paired in groups for projects, and even within same races, this one doesn't want to work with that one because of religious differences or cultural differences or whatever it is. So even amongst ourselves, we can't seem to jump over that attitudinal barrier to really achieve social cohesion and inclusivity. Absolutely. We're a diverse society as South Africans. And yes, we're moving towards this ideal. You and I may not see it in our lifetime, but we have a responsibility to be agents of transformation. So when we look at the health professions, if we could just take a yardstick, while we've been in academia for, say, 10 years, and Saul touched a little bit on sort of what he's witnessed in the past 10 years. It is 27 years post-democracy, did you say? Yeah. And if we look back, how have the health professions transformed in terms of when you and I may have studied, most of us at this institution, and to where we are at now? And what are the current gaps that still exist? How much further do we still have to go in terms of our professional programs? Yes, Prof. Cobbing.
Time in there. I think you're absolutely right what you're saying about we need to look beyond just numbers and faces. And if you look at health sciences, and I'll speak more for my profession of physiotherapy, and there's the data there to support it. The number of certainly black students entering the profession has gone up considerably. You know, in 1994 you would have had 1 or 2 black people doing physio. Now it's actually a majority. But we would be kidding ourselves if we said then the profession is transformed. Because, like Alvin alluded to, when you're talking about positions of influence and power, it's still largely held by white people, often male, even though just by the nature of physio, males have always been underrepresented in physio. But at those higher positions, and if we look particularly at sort of professional bodies, and in private practice, for example, which is where, unfortunately, a lot of our students won't get posts in the public sector after community service. So they have to go look for work in private care. And unfortunately, in that setup, it's still very much young black physios who are doing the majority of the work for white business owners, you know, and these are conversations we have to have. And I think this is why it's so good you are having this conversation. I hope a lot of staff and students watch this, because, you know, disclaimer here, I'll be honest with you, I was a fully paid up member of the Rainbow Nation Club. You know, you can work on my age. I was a matric in 1994, the first free and fair election. And for a good decade, I would have been all about the Rainbow Nation. We don't see color, and now everyone's got an opportunity, and it's great. You know, in time, everything will sort itself out. I don't know when it was when I realized I'm fooling myself. We can't pretend we don't see color, because it plays a role. Look at even the focus of this conversation. If you had a talk about transformation in England, where I worked, there would be discussions about other things, not so much race. But South Africa, there's a reason race comes up all the time, because it has a real influence on people's livelihoods, on whether they're more likely to succeed or not, whether they're more likely to get respect. We've got some of what we've heard just from you guys. And in that sense, I can only really speak for physio, but I know it's similar in the other health professions. We've got a lot of work to do beyond just changing the demographics. You know, just the very idea that, and I know a lot of our students feel this, because UKZN has more black students or what have you, we are less than UCT or Stellenbosch. Even though the numbers don't bear that out at all. In research, we're number 1 in the country. You know, in most metrics, we're right up there, okay? In our School of Health Sciences, and Dr. van Staden's our academic leader of teaching learning, we have exceptional throughput. And this is despite students coming from extremely difficult circumstances. Absolutely. And that's a real feather in our cap to our staff, who work hell of a hard to make sure these students succeed and go on to be very good health professionals. But still, unfortunately, the black students in particular, and probably more so black females, are getting less of a chance.
Yeah.
And I know that because as academic leader, people come and ask me for references for people, who do you want to, and the few white students we have very swiftly go into very good positions. And it's not because they were better necessarily.
Yeah.
And I in no way mean to disparage our white students, because we've generally very good students of all race groups. It's very hard to get into health sciences,
Yes.
right? These are exceptionally bright students. It's our job to bring out the potential, but we mustn't ignore the fact that they are different colors, different genders, they will be perceived differently. And if we ignore that, it's a disservice to them.
And with regards to the transformation agenda being beyond just colour, we had a student qualify in 2018, one of our star students. He was a black boy from a rural community with a major visual disability. Okay, I can't remember the exact name of his disability, but it was something to the effect that if you took a pin and you pricked it through a page and you tried to look through that pinhole, that was the extent of his disability. And that kid showed us how to overcome barriers.
Wow.
He taught us so much. He's currently doing his master's with us at the moment. But he showed us that he would not just give me the opportunity.
Wow.
And if you give me the opportunity, I will show you what I will do. He went on to become the top student of his year, despite the fact that certain facilities in our clinical program, talking about attitudes now, in our clinical program, discriminated against him and said, how can such a student become a physiotherapist? A student with this level of visual impairment. They did not want to house him in their clinical sites and did not want, because of the level of support he required. And so the transformation definitely need to be discussed beyond just color. Here was this kid that came with everything stacked against him. His color, he was not from Wadelsea city area, he was from a rural, disadvantaged school. And on top of that, he had a disability. He overcame all those hoops to become the top of his class and is now, he has a dream to be an academic and to have a PhD, you know. So what are we doing? Fortunately, we had great leaders like Prof. Cobbing and Dr. Nadesan and Prof. Miraj at the time, who facilitated his progress through these supposed barriers.
So it's about creating an enabling environment for students to maximize their potential, given whatever constraints they may find themselves in. I think that's part of transformation. So let's talk about now curriculum transformation. It's been a buzzword, decolonizing the curriculum transformation. The University Capacity Development Program has had a huge focus on curriculum transformation. So what exactly does that mean for the health professions?
Decentralized clinical training.
Do you want to expand on that, Dr.
I'll
Mera?
give someone else a chance to talk. Okay, so, well, decentralized clinical training was one of the imperatives put forth within the transformation agenda to service communities who were less privileged and underserviced. And for us in physiotherapy, I can't speak for the other disciplines, we have completely bought into that model. So our fourth year students who would usually service hospitals like Albert Lutuli Hospital, which is a tertiary level hospital, Addington Hospital, etc., Prince Mshweni Hospital. Our students now go out into hospitals like Ngwelezana Hospital in Mpangeni, Madideni Hospital, etc., and from there still further into the rural communities to do their community service projects. So I think from curriculum perspective, our discipline has definitely bought into that transformation agenda and is running with it at high speed, you know.
Sure.
Yeah.
When I joined the institution, you know, models of clinical training was something I was keenly interested in from my PhD. And it was soon after that the conversations around, you know, shifting towards a decentralized model of clinical training started. And I happened to spearhead that for the discipline of optometry. And I have to say, I have to agree with you that it is imperative in shifting the mindset of our students. Particularly in optometry, I'm not sure about the other professions, but we've lagged behind. We are most underrepresented in the public health sector amongst the health professions. In fact, we're the only health profession who doesn't have community service, I think. Yeah. And we've tried to fight for it for years. So out of 4,000 plus registered optometrists in the country, there's less than 400 in the public sector nationally. So it is a challenge, and as such, our students still sort of just veer towards major cities, practices in malls, and that's what defines optometry practice. And then the 80+% of the population who's dependent on the public health sector in semi-urban, deep rural areas, then have very limited access to primary eye care.
Sure.
So it is about shifting. It's looking at transformation, not just amongst ourselves within our institution. How do we transform how we deliver services to our people, to the population of this country? Many students that go out to these placements then come back and say, you know, patients still have these reservations because optometry is new in the public hospitals, you know, and they've always perceived optometry to be an expensive, a privileged profession, or you can only afford a pair of glasses if you're of a certain economic status. So it's breaking down all of those perceptions, barriers, limitations that become then the mandate of our professions towards South African society in moving towards a more equitable socio-economic status. So, you know, this conversation of transformation is so much broader than the rhetoric that we hear when we talk about transformation, or when politicians talk about transformation. It's so much deeper and more structurally intertwined into our everyday lives that we have to flesh it out layer by layer and start to dissect the things that have been preventing meaningful change from happening. What we certainly don't want to see, I'm sure I speak for all of us, is that at the end of our tenure and, you know, we leave the university, that we're still grappling with the same challenges.
That's right.
Then we wouldn't have had an impact. You know, every year we get a new cohort of whatever, between 40 and 60 students, and we have a responsibility and opportunity to influence them for the next generation, as you said, and to be the role models. So curriculum transformation, I think decentralized clinical training certainly is, again talking with my optometry hat, optometry in the developing world generally was brought to Africa and other poorer countries by Britain and the USA. So historically the curricula have been influenced by these countries. I remember as a student learning about things like North Carolina syndrome or something I'm never going to see it, I'm never going to practice in North Carolina, because the notes were just sort of given to you and you learned things that were irrelevant. We didn't know what the epidemiology of eye conditions was locally, so we weren't focusing on
That's so good that you're mentioning that, because even for me, I've had to change up my content since we've been doing decentralized clinical training, because prior, like I said, we worked in these tertiary institutions, well-resourced tertiary institutions. And I had a student, so I was teaching them, for example, things like coronary artery bypass grafts, and that which are done at Albert Lutuli Hospital. So they were learning all of this, but now they're not there. They're at Ngwelezana Hospital in Madadeni, where no coronary artery bypass grafts get done at all. And they were like, but ma'am, we don't see this, you know. So I had to, and I didn't think about that. And so I had to change up my focus, whereas that was my bread and butter of the kinds of patients they were seeing at Albert Lutuli. I had to now change my focus to trauma, to chest trauma, abdominal trauma, head injuries, because that's what they're seeing in the community.
Absolutely.
So there's a definite content change that has to come with decentralized clinical
Most
training.
definitely.
So not to push the I part, because Diane and I are
Sure.
monopolizing professions.
No, that's fine.
So I don't want to go too heavy on it, but I just want to share a lived experience. Firstly, I just want to say that curriculum transformations is driven by individuals
Absolutely.
and not as a profession. And there's certain individuals in a profession that drive it more than others, and we've got to take some people kicking and screaming along with
you.
us. And so I think that we need to philosophically work on people that don't share our common view, but it's very necessary as articulated. So when I started teaching, I was taught a very British syllabus, and I gauged my level of competence if I could master the syllabus. And Dr. Verstaden always laughs at me, right? And my worldview was very narrow. It was narrow to a Western-centered teaching curriculum, and I would master that, and I would make sure that my students mastered that. And then as you get older, and then your worldview widens, and you broaden on socially responsible way to engage with your students, instead of asking them 10% of the paper on a condition that they will see 0.01% of the time, I've now magnified the conditions that they are more likely to see to more representative. And I always try to mentor our younger academics who come in and who are so pedantic about ensuring that every aspect of the curriculum needs to be mastered. But they don't seem to assess in a way that the student is going to practice in.
That's right.
So we like to teach conditions. We should be teaching conditions that this. So as Dr. Verstaden is talking about histoplasmosis and the Colorado River Valley that she was forced to know, and she's supposed to remember the Colorado River Valley where the fungus grows, and and that's why. So when I start teaching, I always remember what she says. So when I'm teaching that section, I deliberately ignore it because of what she said. Instead, I would go to KZN is the highest population of HIV patients, and I think it's important for me to talk about herpes zoster and young people and herpes simplex and the comorbidities. So whereas when she was a student, she never was taught HIV.
Absolutely.
Right.
I was never taught HIV.
I know.
Didn't know what it was in the so curriculum needs to transfer with the way in which the disease presents and the epidemiological conditions present in a country. And my worry about when we move away from Western-centered disease states is that we are perceived in the world as less knowledgeable because we don't include the world's conditions. And so I think that that's very important for us gatekeepers of knowledge in our context of South Africa, that as much as we need to teach what the whole world's supposed to know, but we need to teach for our patients.
That's right.
Absolutely.
I agree with you 100% there, Dr. Munsami. I'm just taken back to an experience that I had in the classroom. So we use a textbook. I teach in the area of oral rehabilitation in our discipline. And there were questions, within the textbook, and there were answers, model answers. And I remember putting up these questions. We were doing the quiz with the students, and because they already had the answers, the answer that was in the book was not contextually relevant for our South African context.
Right.
And I remember saying to the students, hang on, think about it in this way. Think of our South African context. would this be applicable in our South African context? And I think that's when I started in my head intentionally realizing that even the textbooks that have been prescribed,
Absolutely.
you know, are not for our context, and we are teaching our students something that is not for them. And I started arguing even with the model answers that are within the quizzes that have been prescribed with the textbooks that we are actually using. So the content definitely needs to change, and it starts with us. Going back to DCT, it's an opportunity that has been given by the university for our students to actually go and realistically experience, you know, what it is like being a health professional in a rural context. And them seeing ugogo, seeing a mom, seeing a child who is heading a family, whereas maybe in textbooks that's not there. So it starts there, and gladly for us, it's a good thing that the university has awarded our students with that opportunity. You see it when the students come back from DCT.
Right.
You see the change in their attitudes.
Absolutely.
You see the change in the way that they integrate, even the questions that you start asking them. And it's something that it's something that is good, and it's something that we need to expand even more and enhance it even more. For me, I feel that DCT is quite late, even at fourth year level. I honestly feel that from second year, when students start seeing patients, they need to be going into these contexts and familiarizing themselves with within these contexts. What does that do? It allows for these students, even when they move from one level to the next, the attitude
Yes.
and the way that they provide a service to a patient will differ from a person who's done DCT only at fourth year level.
That's right.
Because the mindset has started at second year, third year, you get to fourth year, it's done. It's done. The students know exactly how to be treating a patient from any context that they actually are exposed to. So even in the questions that I set up, even for exams or quizzes or TATs or whatever, I always come back to our South African context. I'm so conscious of that. I always come back because for me it's relevance. What is relevant for our students? I blame us though, as academics. I blame us because we've been taught in that way, and we're continuing
That's right.
in that way.
Absolutely.
And we are supposed to be making that change even through research, if it's possible. You know, the research that we do, the information that we teach needs to be from our context and not so much focus on what is happening elsewhere. We're dealing with content from developed countries. We are still a developing country. Now, also with the introduction of COVID and online, it has brought in another dimension into the way in which we are actually engaging and teaching our students. So I don't blame anyone but us as academics. We need to start having, I love that we're having these conversations. And I was just saying this morning to my husband, I was saying, we need to have more of these conversations because it makes us very aware, makes us very conscious of them, and in everything that we do, we become intentional, you know.
Yes.
And that will drive that agenda. As Dr. Monsami was saying, some people, you have to drag them along. Eventually, they will come along, but the more we engage in such conversations and the more we are intentional in what we do, even within our own modules, within our own disciplines, I think even with the students that we're going to be having going out there and working there will be students who know how to provide service for any patient, regardless of context that they come from, regardless of socioeconomic background, regardless, they'll be able to provide that service. That's my thoughts.
No, absolutely, thank you. Again, it comes back to, you know, this weight of responsibility.
Yeah.
Because then it's up to us to rewrite the textbooks.
Yep.
Yes. I was just going there.
You want to add to that?
No, I just feel that that's the problem, is that none of us in the last 20 or 30 years have written textbooks for our students. And our predecessors didn't see it. So I'm glad that we are seeing it and we're having that conversation. and that we all need to start to write our own textbooks for our profession if we want to change the way our profession looks. So the manual is in America, the US, and Australia, right? And the actual action is in
Africa.
In Africa. It's not going to work. We need to start, but I don't think we've recognized that we need to do that.
Yeah.
Can I add, I mean, I agree with you about the textbooks. Although things are changing now, we look at other sources.
Yes.
But largely speaking, the experts are still seen to be, let's be
Okay.
honest,
The ones who write the
white,
textbooks.
Right.
Western,
Yeah.
Yes.
male largely. So in our profession, Stacey will know these names. You have Maitland, Mackenzie, Pryor, Kenyon, you know. None of those really sound like a broad spectrum of South African. Now make no mistake, in South Africa we have exceptional minds, physiotherapists in academia who are black, Indian, coloured women. So where are the textbooks by Chetty, by Mayezwa, you know?
Absolutely.
Where's the textbook by Pefile, right?
Yeah.
And like it or not, when people, particularly young students, they're impressionable, they see a textbook, it has weight, it has
That's
sort
right.
of
Yes.
that sense of
There's
expertise,
knowledge
and
here.
we'll always be chasing that. And this is where, as much as I applaud the DCT initiative, we must be careful it's not just a geographic shift, right?
Yes.
Right.
We've got to have a real pedagogical shift, a big word, you know,
Yeah.
the way we teach, what we teach, where we teach, who we teach, bring in to teach
Yeah.
as our
Absolutely.
part-time staff, who we get as students, and this gets to the heart of what we're discussing. You know, are we just ticking a box on colour, or are we looking at getting students from specific communities who are underrepresented?
Yeah.
Okay, and the reality is you talk about inequity, you know, there's a difference between equality and equity.
Yeah.
And equality is you just give everyone the same thing and
Yeah.
expect the same results. But in equity, or equity is understanding people come from
Measure.
a different background.
Yep.
And the reality is, as we do take a responsibility, but in South Africa, as academics, we've got a much greater burden than our
Yeah.
counterparts in the West, who I know.
Yeah.
I worked over in the UK, I studied there. They've got the time and the space. They're not grappling with these things to sit and write the textbook, okay?
Yeah.
I'm not making an excuse, but
It's the reality.
w-
Yes.
until we do that real shift in who's seen as the experts, okay, and we all have started making changes in the last 10 years. Look at how HIV is coming to all our curriculum.
Yeah.
But the experts are still seen to be out there. It can't be that someone in your staff is an expert, but actually we have real experts here who stand as equals with anyone in the world. So
Yeah.
we must be unapologetic about that.
Yeah.
Yeah.
Most definitely. And, you know, I'd like this message to go out to not just academics within the health sciences. Certainly we're talking about health professions education here, but I think across higher education institutions, that's the kind of transformation we need to see. I'd like to start drawing the conversation to a close by bringing in the element of expanded graduate competencies, which is linked to curriculum transformation. That's also very close to my heart. Historically, we've been focused on sort of developing students who can demonstrate competency in hard skills. Of course, yes, they must be able to test eyes, they must be able to, you know, provide therapies for patients, etc. But there is so much more to being effective within the health system than just being able to provide a good clinical service. And I'm sure you're all familiar with the expanded competencies. They were, funny enough, developed in Canada and then adopted by the rest of the world. And some South African academics are tweaking it for the South African context. Things like a graduate in health sciences needs to be a good communicator. And I'm sure we've all seen that. Students were excellent clinicians but very bad communicators. You know, how do you take a good case history from a patient? How do you communicate the clinical findings and provide ongoing therapy? To be a good leader, because for many of these graduates, they're going into a hospital on their own and they need to effect change, whether it's change within the institution, change within the community. And so as part of curriculum transformation, then we have to think beyond our subject matter. We have to think beyond, I'm training an optometrist. I'm training someone who needs
A
to be an
leader.
advocate. An advocate for physiotherapy, an advocate for health professions development, an advocate for social change in South Africa. And then the question is, how do we do that? How do we bring that into our programs?
Do you know, as much as we can applaud the university for some of its transformation agenda, where we felt that we've lost the plot a bit is in, I don't know if in your programs in the health sciences, you guys ever interviewed students?
A few years ago we
to
did.
select.
Yes.
That was shifted, I think, maybe about 4 or 5
5 years ago, could be,
yeah, where the selection process was sort of dumbed down by we only looking at marks to make it more objective and more inclusive. But in a way, I feel, because what you're talking about is core competencies, right? And yes, we should be able to develop them in the students. But at its roots, are these students that we are bringing into the program the students that have the aptitude to begin with for us to develop these core competencies in? And what we've found in our discipline, don't know about the rest of you, is that we are sitting with a bunch of students year in and year out since the interview process has been removed, who've got physio as their 6th choice.
Yes.
But because they don't want to do it, so they don't have the desire, they don't have the aptitude, they don't have the inclination, and we're battling.
No.
We're battling with many of the students. So I think before we can even get to that level of really developing the core competencies that we want in our students, we first got to select the right students. And I understand the challenge with selecting the right students because we don't want it to be subjective. But can we not think around maybe having a panel of people representative, black, white, all demographically represented, where we sit and we interview a student before bringing them into the program beyond just their academic performance in the
Sure. Absolutely. I couldn't agree with you more because I know that I've been one of the advocates for bringing back the interview process, and we've repeatedly been shot down. Simply because in optometry we face the same challenge. You've got students who, towards the end of their first year, they're like, well, what is optometry? They don't even know what this program is that they've been accepted into, who have no heart for the profession, no passion. So how do you instill that in someone who really doesn't want to be there?
Yes.
How do you make a change agent out of someone whose heart is in something else? They're just doing it because they need to do something. And so I think those are the hard conversations that we need to have at an institutional level. Again, going back to, it's not a numbers game. There is so much more. If we want to transform society, we have to start with the roots. And getting people in who's really going to run with fire in their belly to make a change in the country, not just in their profession, in the country and in their communities. So I think that is pivotal. Maybe, and then just as a closing sort of question, we've discussed a lot of what is our responsibility, what we are doing and what we should be doing, but what are the current opportunities for this particularly for the new generation of academics who have this weight of responsibility to drive the transformation agenda? What opportunities do you see for us collectively, and then either within your disciplines or in health professions education, in general, to move towards this ideal?
As you can see, Dr. Verstappen, is that we're all living in silos, but we have the same problem.
I'm so glad it was highlighted in today's conversation.
Right, and that we need to start talking to each other because we're living in parallel universes. Right? And I think that many brains can answer a question, not just yourself. So I think that we need to start recognizing that we all have common issues, and together we can try to come up with a solution that not necessarily be perfect for each one of us, but maybe a start. I think starting to listen to each of us, each our own lived experiences is very, very important as academics, starting to listen to our students, because we never talk about our students' experiences. And I find that when my students hit final year, I always ask them this question: are you happy with the choice you made?
Yeah.
It's a very, very deep question.
Yeah.
Because I meet some of them in third year now, they say, I don't want to be here.
Yeah.
You know, I'm going to, it's a stepping stone there. So I said,
Yeah.
okay, I'm going to
Many
take
of
the
them.
challenge and change your mind to watch me how I approach this. And so I win some, I lose some. But I do think that the conversation needs to be a common conversation. In
Right.
anything, we need to have a conversation together. And I think that we can even research and inform, and research also impacts policy.
Absolutely.
And policy impacts societal changes. So that's a small starter that I think we need to do.
Thank you very much, Dr. Monsemi. I think that's a perfect point on which to close the discussion. But just to say that recently I did an audit of research, teaching and learning related research within the School of Health Sciences, just to get perspective as to how many academics are actually doing scholarly work as pertains to teaching and learning. And I was pleasantly surprised to see that there were 38 projects linked to undergraduate teaching and learning. How do we improve our programs within the School of Health Sciences? So I think that that in itself is transformative. I think historically health sciences has been focused on more clinical type research, and it's now people are starting to do the more qualitative. Is what we're teaching relevant? How do the students perceive it? What can we do better? And I think being reflective is so important. So
Absolutely.
I'm glad we've started these conversations, and I do hope to continue. As I said, it's the first of the series, continue with other academics in the School of Health Sciences, and collectively we can then shape how we move forward towards enabling a more transformed South African society and health professions in general. So I'd like to thank you for your time today. Thank you for engaging so constructively. And yes, I hope that you enjoyed our show today and that you will join us for the next in the series of Conversations in Health Sciences. Thank you very much.
Thank you.